Welcome back to Now Media's TV show, Pain Diaries, broadcasting here in Houston, Texas on channel 2110 on Now Media TV. We are back to talk with Dr. Alan Burton.
Hi, Suzanne. It's nice to be here with you today.
Thank you so much. We're going to take a deep dive talking about transforming pain management. We're going to talk about Abbott's spinal cord stimulation portfolio. And Dr. Burton, he's the Chief Medical Officer of Abbott, a giant player in the healthcare world. The Neuromodulation platform and division is what holds the house of the portfolio of spinal cord stimulators. Abbott has two different stimulators. One is traditional spinal cord stimulation, and the other one is called DRG.
That's right, Suzanne. We have a really, we think, market-leading portfolio of neuromodulation devices to really meet the needs of different chronic pain patients. And as you mentioned, I think our really standard therapy is spinal cord stimulation, which is for those patients who have severe refractory back pain. They've had multiple surgeries, they have scar tissue in their spine, and they're just suffering with unrelenting chronic pain in spite of having had previous back surgery, lots of attempts at physical therapy, other kinds of injections, other kind of pain therapies. And then those patients often become a little bit hopeless about their pain state, and those are perfect candidates for our electrical stimulating devices, which then in many cases can give them a large part of their life back by alleviating their chronic pain. And then as you mentioned, the DRG stimulator, which is really more for focal pain and pain that people sustain after injuries, trauma to the knee, to the foot and ankle, and with nerve damage and severe focal pain. And then the DRG stimulator can help that subset of patients to really get their life back.
Yeah, I love the portfolio that Abbott offers, and I offer these options to my patients too, and I've had some great successes with these products. So can you kind of define for people what the difference is, basically how spinal cord stimulation is different than other types of chronic pain treatments?
Sure, yeah, I'll definitely give it a shot, Suzanne. Thanks for the question. I think electrical stimulation for chronic pain has really been around almost for 50 years. And I think in the last 5 years, we've made really significant advances. Our therapy we call burst DR spinal cord stimulation. This particular mode of stimulation, when it is activated, stimulates the patient's spinal column in a subsensory fashion. What that means is that the patients don't feel the device operating. Think of it as almost a noise-canceling headset for the pain signals that are going through the spinal cord. This electrical energy that's transmitted into the patient's nervous system dampens out those pain signals before they reach the brain, making the pain signals less intense and making them more tolerable, so that the patients feel that their pain is, in many ways, has subsided or has gotten much more controllable and tolerable with the device installed.
Yeah, I know patients, a lot of them love to not necessarily feel it. And so that noise-canceling headphone effect, that's a great description. Because obviously my job as a pain doc is to give the patients something to alleviate their pain. And our job is, now to try and curb the opioid use.
Sure.
And spinal cord stimulation in my practice has been a great way to utilize a pain management technique to reduce pain medication use.
Sure.
And obviously we want patients to be happy and live their best life. And that's what Abbott allows us to do.
I think that's right. One of our mantras at Abbott is life to the fullest. And we feel that when you select the right patient for this therapy, and then uniquely to this therapy, there's a trial period so that you, as their physician, can place the what are called the leads or the electrical wires into the right location, either in the patient's spine or in the case of DRG stimulation, near a small clump of nerves called the dorsal root ganglion. Then over about a week period of time, the patient gets to experience that relief that is a trial period where they get a sense of how much relief would this device provide me. At the end of that week, they come back and visit with you and make that decision together. And often their family's involved in that. How did mom or dad or husband, child do that week? So you get their story, you get the family input, and then your physician input comes together at the end of the trial, deciding whether or not to go forward with the implant, which is, I think, is a really unique and important aspect of spinal cord stimulation.
Absolutely. I always tell them too, you get to test drive a car before you buy it. That's what this is. You do your test drive first. you're gonna not just go test drive that car by yourself, you're gonna bring your family and make
Mm-hmm.
sure this car is going to work for all of you, not just, this is not an individual decision always. It's always involving patient's family and hopefully fitting their lifestyle to really make a difference.
Yeah, I think that's a really important point you brought up, Suzanne, that the patient gets to experience this pain relief not just, let's say, in a medical setting or not just in the office or in the operating room, but they actually get to have that therapy for the trial period in their life, and they get to take it back to their home or to their workplace or interacting with their grandchildren or whatever the case may be, and see how the impact is of that therapy within their life. What are their goals? Where do they, it's really personalized for them. What has the pain limited them from doing? And can they get a sense of they're getting some of those activities back during that trial period?
Right, and I know one of the newest indications is diabetic peripheral neuropathy, which is that burning sensation people can get from the nerves in their feet that really is very uncomfortable and not very painful. So can you elaborate a little more on where Abbott is in this space?
Yeah, we're quite excited about this new indication for treating the pain associated with diabetic peripheral neuropathy. We got this indication around a month ago, and what we're really excited to meet the unmet need out there. We know there's 30 million plus Americans who have diabetes, and somewhere between 20 to 40% of those have severe pain in their extremities, mostly in their feet. Where this really impacts a diabetic patient is often diabetic patients can have trouble with weight gain, and with especially the type 2 diabetic. And sometimes when their feet are burning or hurting, they're in a catch-22 where they can't exercise, and their doctors want them to exercise and become more active, but their feet hurt too much. So the patient is a little bit in this catch-22. Then often they're tried on medications for this nerve pain. Some of those medications cause sedation, or many can cause weight gain, which is actually the opposite of what the patient's trying to do with their activities. So in those patients, again, the same paradigm where you trial the device for about a week, see if you're getting that relief, and then go forward with the implant. So we're really excited. At Abbott, we have a large diabetes business with glucose monitors, and we're looking forward to interacting with those patients through our Abbott diabetes colleagues, finding them and helping with this unmet need we think that's out there.
Yeah, that's fantastic. Now that the indication is there, about a month you said, us as pain doctors, we've really kind of been using the treatment for years for this pain, technically off-label, and that's what a lot of what we do in the world of pain management. But I'm glad it's on label now, because then I can actually advertise it to patients and say, hey, this is actually FDA indicated for your problem, not just let's just try this and see if it works for you.
Right.
So
right.
I'd love
that. We think that's an important process. As this therapy's matured, it's been around for several decades, and it has had what's called a wide open FDA labeling, which is for chronic pain of the trunk and extremities. And then as we've advanced the science, and now we have more effective therapies like DRG stimulation and burst DR stimulation, we have something called Flex Burst DR, which treats multi-site pain in patients with progressive pain, not just in one area, but in multiple sites, up to 6 different locations of chronic pain. As we've advanced those therapies, we're going through the FDA process to get more and more indications, which will help payers to cover it.
Right.
It'll help raise awareness, and we think elevate the science and the amount of evidence that's out there for the therapies.
Absolutely. I know there was a lot of push a few years ago, in Texas especially, for DRG to be on for certain insurances, and we now have that. And it's been great because I am, the recipient of the fight that we have to do for insurances, and the patients are the ultimate recipients of the therapy that works amazingly.
Patient access to these advanced pain therapies is always challenging. I mean, there's several aspects to it. One is raising awareness, which is why I give you so much credit for Pain Diaries and this kind of show, to get awareness out there, get patients understanding they don't have to live and suffer with chronic pain for decades. There are some other options beyond just medications, more physical therapy, and even things like injections. There are other devices, other options for that chronic pain. And then secondly, and as importantly, is to make sure that it's covered by either, let's say, Medicare or the commercial insurance will cover those therapies, enabling you as their physician to really connect those dots and help those patients out. So we're really excited about that.
I'm really excited too for the further advancement of the technology, because it's an amazing tool that we have in our toolbox to help people live better.
Right.
What should somebody do if they're interested in trying or learning more about Abbott spinal cord stimulation?
Yeah, great question, Suzanne. We have a great website that's alive, and you go to abbott.com and then drill down on the neuromodulation component of this, and you can find direct-to-patient information, you can find helpful videos, and connect in through there, even to a physician finder, to hopefully locate somebody as experienced as yourself through that website.
Yeah, no, it's definitely a great website.
And also, I would mention patients should work through their primary care doctor as well, or their connection into medicine. Often their primary care doctors will connect the dots and say, oh yeah, you're with your diabetic neuropathy, your severe ongoing back pain, you should go see Dr. Manzi.
Right. Well, Dr. Burton, I've known you since 2012 when I moved back to Houston, and that was right after you transitioned from MD Anderson as the director there. Then you went into private practice. Now you're the CMO for Abbott since 2015.
That's right.
So how are you liking your new role as not actually seeing patients?
Sure. Yeah, thanks for the question, Suzanne. It's very exciting. I think I spent about 20 years in practice. And as you know, in the trenches, there are amazing moments where you get to help people and you really change somebody's life,
For sure.
And they're great. But there's also a lot of hard work in the trenches and just the grind of seeing a clinic full of patients, dealing with insurance companies or denials, or some of the more challenging issues that face a busy physician. So I think you definitely see those and face those head on. So I miss some of those great moments with the patients where you've helped, but I don't miss those challenges. And what I feel is that with a company like Abbott, been able to expand my impact and by advancing new technologies to helping even more patients through that corporate lens with some of our amazing technologies, including our latest, Eterna, the smallest implantable pulse generator on the market for spinal cord stimulation. And we at Abbott continue to advance the therapies, and it's so exciting to be a part of a dynamic company like that, bringing these life-changing therapies to patients.
They're really lucky to have you. Thank you so much, Dr. Burton, for all the amazing information about spinal cord stimulation with Abbott. I'm so happy you were able to join us today for this interview. I'm Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. And this is Pain Diaries. Take care of you so you can take care of business.